It's Monday.
Monday.
A little gloomy in San Diego.
We got our May gray going.
But we thought we'd do an Art of Skin MD lunch and learn, like quick.
Yeah.
Christy Cashman, of course, one of our non-invasive body contouring experts. Georgia, Cavalier extraordinaire.
Our beauty.
And I'm Dr. Palm, board certified dermatologist. And so we thought we'd talk about, we have a really great offering this month. And so and actually through June. So May and June, combining two of our technologies to help with fat reduction and muscle toning. So maybe you want to take it from here and explain it.
Absolutely. So fabulous special. And what we're trying to do is help everybody use this beautiful duo together to get the best results for body contouring. And so we're doing Coolsculpting and EMSCULPT NEO, a special on the two of them together. Coolsculpting is our treatment for freezing fat, and then EMSCULPT NEO is a treatment that also helps reduce fat but tones the muscle in addition. So using the two of them together can give you sort of the most optimal result to shape and contour your body. The special itself is purchase 8 Coolsculpting, you get $1,000 off your Coolsculpting, and the EMSCULPT, and 50% off the EMSCULPT NEO, which is a really nice reduction
I think
in
it's
cost.
about $3,400 in savings if you're doing the combined. So
yes.
We've never done anything like this before, but we're in the middle of May, Gray, June gloom, and so this is actually the perfect opportunity to think about doing things, because it does take, if you look at the EMSCULPT results, we usually monitored them at 1 month and 3 months out. Coolsculpting, typically a series of treatments, but Christy will talk to you about what your needs are during the consultation. But it really takes a couple months to start seeing the effects of things. So we want to be thinking about this now if we're getting ready for summer vacations. It's a really good opportunity, and so we wanted to be able to extend some savings for you. And then I believe they get a product maybe as well. Are you guys doing something? Or we'll definitely talk about Body Transform with that.
Yeah, absolutely. We do recommend Body Transform by Elastin with our body contouring. It helps with the skin tone and texture, but it also has a specific peptide in it that helps to break down the cellular debris that we are creating with the fat freezing and or fat heating, I guess, with the EMSCULPT NEO. So it just helps the fat cells to be broken down so that your body can eliminate them easier and faster.
Yeah, so it's a process called autophagy, and it's octopeptide 11. So basically, if fat cells have been treated either by extreme of temperatures, cold or fat, so Coolsculpting versus EMSCULPT, sometimes they sit in limbo, and our body has a process called autophagy. It's a process of eating ourselves. So our body digests cells that are not particularly healthy all the time. Millions of cells, this happens. And so it really helps hone in that skill if we have injured fat cells that we're actually attempting to try and get rid of. This cream, topically, it's actually able to penetrate down the hair follicle through the dermal white adipose tissue and actually get a direct communication to our fat. And it tells some of those cells that have been injured that, hey, you shouldn't stick around and you should really go. So we were actually a site for the topical treatment, doing sort of a side-by-side comparison. So one half, in this case, we were doing EMSCULPT, and we were treating one half with the cream, one half without the cream, and then doing EMSCULPT to the entire abdomen, and found that we could reduce fat by an additional 30 to 50%. So I think generally speaking, in chatting with Christy and chatting with Ricky, if you come in for a consultation, they will talk to you about the importance of pinchable fat. That's what we want to debulk first, but then we want to be able to reveal the amazing musculature below. So we usually start with something like Coolsculpting, and then move on to EMSCULPT NEO for that sort of final finessing of removing the fat and then toning the muscle. So in the studies across the board, it didn't matter what site, what area of the country, what anatomical site we were treating. By and large, the studies show with 4 treatments of EMSCULPT NEO that you reduce about 30% of the fat and get a 25% gain in muscle. And this is really important because as we age, we start to get more visceral fat, we get more sort of central adiposity, that means central fat deposition, as a result of hormonal changes and lifestyle changes, and we lose muscle. So starting in our third or fourth decade, every 10 years, unless you're an extraordinary Olympian doing everything that's possible, or under the EMSCULPT machine, you're losing about 10% of our muscle mass. And that becomes a problem when we get full-blown sarcopenia, when it starts to affect our balance and our day-to-day life. And we want to have full, long lives, but we want the best quality possible. So in addition to all the amazing aesthetic benefits, there are definitely benefits to getting our adiposity at a lower level, so our fat stores, to gaining muscle. And we know EMSCULPT NEO, although this isn't a direct effect, when we do treat areas like the abdomen or do reduce some of our central fat, there's a secondary effect of gaining muscle, losing fat, where we start to affect free fatty acid metabolism, and we can start to affect visceral fat. So interestingly, I mean, I've had all these things. You know, I've had Coolsculpting to my inner thigh. You did a treatment to my little, just my left side of my little bra fat. And then I've kept up with EMSCULPT. We actually just showed that a couple of weeks ago on a live. And I went into the gym and I had sort of my body assessment done. And this body assessment looked at my overall muscle composition, my adiposity, and then my visceral fat, which is the inside fat that's so unhealthy that we want to be careful about how much we have, because it's very much related to cardiovascular disease, syndrome X, and it was like 3%.
Wow.
And so that's a really low level for women, and I credit that to, you know, I work out every day, but I also try and do supplementary things, you know, healthy lifestyle, healthy diet, minimizing alcohol intake, getting my sleep, staying really happy and connected with my community. But then I think something that really is helping me as a thin woman maintain my muscle mass is really hard and important to do. So I credit some of that to consistently doing something like muscle toning.
Well, and then once we hit menopause too, it's so hard to maintain that, and then you get those little added little spots of localized fat pockets, and so that for so many of my patients, these treatments have been a godsend, because we can just really localize where we're treating the fat initially, and then go in and sort of smooth things or finesse things and tone those muscles underneath. So it's such a nice combination.
And there's so many areas that are now on label for this. So maybe you could march from like the jawline down to all the areas that we can treat.
So we can treat the jawline, we can treat under the chin here, this little area along the jawline, and really kind of sculpt that area. We also have M-Face that helps with that, which is similar to EMSCULPT NEO, but for the face. We can treat arms, we can treat tummies, we can treat bra area and through here. All along the back, we can treat flanks, which are sort of love handles, the upper sort of back with the bra, that bra area. We can treat inner, outer thighs, along the knees here. So we can treat glutes with EMSCULPT NEO, the posterior thighs. So we have, I mean, we pretty much have the full body covered from, you know, nose to toes.
Yeah, and I think most men struggle with sort of the spare tire.
Oh, yeah.
Central adiposity. So circumferential treatment, I think, is really important, and Christy talks to patients about that.
Absolutely.
Women, we get a gynoid, I should say, distribution of fat. So it tends to be hippie, abdomen, thigh. So we're slightly different fat distribution, but certainly have ways to tackle them. And I think Christy and Ricky are exemplary in sort of their advanced technique and assessment, because that's really important with a Coolsculpting and EMSCULPT provider.
Everyone is different, and so when you come on in, we'll do a personalized assessment and see which areas you want to target. And
and Christy's here Monday through Thursday, Fridays on select days, and Ricky's here on select Fridays. They do not charge for consultation, which is amazing. They are such a wealth of information, and both of them have been involved in clinical studies, which I love.
Absolutely.
These are people, and you are an instructor, a former instructor for Coolsculpting. So, you know, I think it really is nice to have somebody who's a true expert in their field. And, you know, when you teach somebody else, you have to master what you're doing. So I think if you have questions, I think this is a lovely special. We've actually never done this combined, but we do this so much combination treatment that I think we wanted to be able to offer this for patients. Absolutely. So if you guys do have questions, Christy and Ricky are available, and we're closed currently over the lunch hour, but are here typically from about 8:30 to 5 p.m. So give us a call. Our phone number is 858-792-7546. Our website is a wealth of information. It's artskinmd.com. And just to recap, remind everybody what this special is. I
So the
guess.
special is a combination of Coolsculpting and EMSCULPT NEO. It's 8 Coolsculpting applications, $1,000 off, plus 50% off EMSCULPT NEO, a series of 4. So we can just personalize what areas you would like to target, and come on in for your consultation.
Get that summer vibe going,
Yay.
and be cool and
Yeah.
confident going into this summer. So I am going to end our little live, but I want to thank you guys for tuning in, and
so
we'll post this to our accounts as well. And hope you guys have a great week. Okay, talk to you soon.